Good afternoon, Glenn Backus. I'm a board member for Los Angeles Community Health Project, speaking in favor of the restoration of syringe exchange funding, but focusing primarily on the Drug Policy Alliance request for $2 million for drug overdose. A fellow board member is Dr. Peter Davidson. He's a researcher at UC San Diego, has been researching overdose for 12 years in Australia and in California. He ran the numbers. What would $2 million mean in California, spent over 3 years? He based the numbers on the effect of a similar program in Massachusetts that was reviewed and published in the British Medical Journal. Running the numbers carefully, a conservative estimate of how many lives would be saved for the spend of $2 million is 600 to 800 people. 600 to 800 families over 3 years. It's a one-time ask in order to demonstrate that the state can have an effect on reducing fatality and reducing the suffering of families. Additionally, I'd like to speak to the demand of families. Our program in Los Angeles was built to serve Los Angeles, working primarily on Skid Row, in Watts, in Hollywood, doing outreach programs, needle exchange programs, hepatitis C prevention, transporting people to medical care. We started an overdose project with naloxone 3 years ago. The demand outstrips our capacity. Not just in Los Angeles County, our calls are from Ventura, our calls are from Riverside and San Bernardino, Orange County and San Diego. We don't have the capacity to serve these other counties as well. We would support the grants so that they could have their own programs, or we could hire another trainer to make the long drive out and do the work. Thank you very much.
Thank you very much.
Hello. My name is Dana Richkin. I am a registered nurse, and I am the mother of a 21-year-old son who has struggled with heroin addiction for the last 6 years. You heard from my good friend Loretta earlier about having lost her son. I've been really fortunate to this point to not have experienced that level of grief, although I every single day worry that I may lose my son to an overdose. He has overdosed several times. And the first time he experienced an overdose, his peers were afraid to call 911, and they shoved him into a car to try to take him to an ER. And he almost died. Beyond that, he experienced an overdose, and his peers had naloxone that they received from a community-based overdose prevention program, and his life was saved, and he didn't lose valuable time and oxygen to his brain. He's not in a coma. He's not in an ICU. He's not in a wheelchair for the rest of his life, and I'm not grieving the loss of my son like my friend Loretta is. So I encourage this funding to save lives. I am a member of a East Bay Overdose Prevention Work Group, which is looking at expanding naloxone programs into Alameda and Contra Costa counties. And I'm sitting on this work group as a mother, and I'm learning as I go along. And harm reduction organizations that are providing naloxone right now in those communities, they're getting calls from parents like me wanting naloxone and overdose prevention training, and they're getting calls from treatment centers. And the problem is they don't have the money to send the trainers. They don't have the money to keep up with the demand for this life-saving medication. And I can speak as a nurse. I've worked as a labor and delivery nurse, and I've administered naloxone for years. There's no potential for abuse. It's an incredibly safe drug. It has no action whatsoever except for to reverse overdose, and it does so safely. Saving lives not only saves families from grieving, but it also reduces healthcare costs ultimately. Not all victims of overdose die. Many languish in intensive care units or suffer with long-term costly healthcare outcomes. My son's worth saving. People struggling with a disease of addiction deserve a fighting chance, and overdose prevention services meet this need. So I urge you to fund overdose prevention programs in California, and I thank you for your support.
Thank you very much. Hi, thank you. I'm Julia Clems. I'm a public health worker in Alameda County. I also, like Dana, who just spoke, I wanted to echo all my colleagues and friends' support for the drug overdose prevention grant that the Drug Policy Alliance is proposing. I also work for the East Bay Overdose Prevention Planning Council, and as Dana was saying, it's a network of public health workers, health professionals, and concerned community members working to expand naloxone access in Alameda County and into Contra Costa County, where there is very little. The evidence clearly points to the value of naloxone distribution and training among injection drug users in preventing fatality from opioid overdose, now an epidemic in our counties and nationwide. We see many opportunities to really expand access to naloxone, and the demand is there, the need is there. People are calling needle exchange programs going, how can I get some? How can we train people? And we are kind of tapped for resources. That's our main challenge, is money. It's a cost-effective thing, aside from just being life-saving. It's really cost-effective, as Dana was pointing out. And I thank you for considering this for support.
Thank you very much.
Hi, Ben Rubin with Children Now. I'm here to comment on a few items. First off, on behalf of Children Now and the Center for Youth Wellness, just wanted to support the funding of the Adverse Childhood Experience Survey questions. ACEs cause a lifetime of health consequences and inflated costs for states' healthcare and public health systems. And we are thrilled that the Department of Public Health has secured funding for this year to better track ACEs, and just want to thank the committee staff and DPH for their attention to this matter. For the rest of my comments, I'm representing the California Children's Health Coalition, which consists of Children Now, the Children's Partnership, Children's Defense Fund California, United Ways California, PICO California, and California Coverage and Health Initiatives, Children's Coverage and Health Initiatives. Our coalition supports targeted reinvestments in programs that are supported by strong evidence to improve negative health outcomes for children in California, and want to comment on 3 programs in particular. First, the Black Infant Health Program, since it addresses an alarming disparity in infant mortality and preterm birth rates. Second, the Dental Disease Prevention Program, for its inclusion of proven programmatic elements that improve children's oral health outcomes at a time when dental disease is the most common chronic health problem among California's children and a top reason for missing school. And finally, the Early Mental Health Initiative, which, as you've heard, has a tremendous track record of success and is an ideal program to help communities support the healthy, social, and emotional development of their young students before these moderate problems become barriers to later success in life. So all 3 of these programs should not only improve health disparities and address negative health outcomes, but are expected to reduce long-term Medi-Cal and other costs to the state. And finally, our coalition is also in support of the Medi-Cal primary care rate bump. Thank you.
Thank you very much.
Good afternoon, Melina Blake with Californians for Safety and Justice. We are a statewide organization that looks to more effectively and efficiently spend our public safety dollars and make our communities safer. The best way to make our communities safer is actually to prevent crime in the first place, which is why that we're proud to partner with Children's Now and the Center for Youth Wellness to raise the issue of adverse childhood experiences. In addition to the health predictors that Ben mentioned just a second ago, it also has very strong predictive qualities for public safety outcomes, including substance abuse and involvement in the juvenile justice system and ultimately the adult justice system. So we want to thank the committee staff very much for helping us figure out how to get this very small investment to help track these adverse childhood experiences. Thank you.
Thank you.
Good afternoon, Kirsten Barlow on behalf of the California Mental Health Directors Association. I wanted to associate our support with the comments you've already heard about the Early Mental Health Initiative, but also wanted to echo our support from your very first speaker this afternoon of peer respite mental health services, which in our opinion are a really promising model that provide a home-like setting for people in mental health crisis to recover rather than be hospitalized. They also provide a really excellent opportunity for mental health consumers who have unfortunately low numbers of employment to actually gain a really enriching employment experience working in the peer respite mental health centers. With only a few communities having found the resources to start these so far in California, the state has an opportunity to take this to scale and bring this program to other parts of the state. Thank you.
Thank you.
Madam Chair and Senator Monning, Bruce Palmer with the Health Officers Association of California. I want to express our support for one of the items that we're sponsoring, the TB Trust Fund. You've already heard from Health Officer Olivia Casiri of Sacramento County, so I won't repeat that testimony. The other item that we're sponsoring here today is the public health training item. As you will recall, 3 years ago, $2.2 million to qualify public health lab directors in our 35 public health labs around the state was eliminated. I'm here today to testify on behalf of the Health Officers Association, also representing the California Public Health Lab Directors Association, and also have been authorized to speak in support of the lab training partial restoration by the County Health Executives Association, CHEAC. The 35 labs that we're talking about in the state of California, local labs, are absolutely critical to the state's capability to do disease surveillance, monitoring, and follow-up. They deal with the most esoteric and difficult investigations relating to tracking down a foodborne infectious disease or a vector-related disease. And their specialty is absolutely critical. The state works very cooperatively with them. When we had the H1N1 outbreak, West Nile, the state worked through the local public health lab, so it's a critical part of our public health infrastructure. And what we're asking for here is something slightly less than $1 million of a $2.2 million program. We have 12 lab director vacancies right now in the labs. Another 12 individuals will be retiring in 5 years. What's so difficult about this, and I'll finish with this, is that you're required to have a PhD, which is a federal requirement. You're required to be public health microbiologist certified, board certified, and have 4 years of experience in a lab. That's why we need the support to get at least 6 of these positions under an assistant lab director placed in the labs so they can become qualified public health lab directors in 4 years. Thank you.
Thank you very much.
Good afternoon, Shannon Smith Crowley, representing the American Congress of Obstetricians and Gynecologists for California, over 5,500 obstetricians and gynecologists. We do more than just deliver over 500,000 babies in California, but that's a very measurable area to start with. And I want to say all of the programs I've heard of and the ones that we're promoting are smart investments. And there's a common theme in terms of the high-tech, high-touch, low-tech. We're not looking for big capital investment. We're looking in very basic primary care services. For instance, the Black Infant Health Program. If you have any doubt about this population needing these services, there's a short 30-minute documentary called When the Bow Breaks that talks about why this population, compared to any other population in California, needs these specific services. And I want to say it's not only a higher infant preterm rate and death rate, but maternal death rate as well. So that's a very critical program. We also support the Medi-Cal primary care bump. The primary care residency programs will include OBs that specialize in primary care. And then also on the Medi-Cal rates, I know we've talked about this, but that if you look at what the Department of the Department of Healthcare Services has for access standards, that won't tell you today if a pregnant woman can find an OBGYN to care for her. They're long-term data that will take quite a while to get. Also, I'd like to say on behalf of the American Association of University Women that we do also support the school-based health center money. So thank you.
Thank you.
Clay Kemp, Executive Director of the Area Agency on Aging of Santa Cruz and San Benito counties. And of all these worthy projects, there's 2 I really need to highlight. One you've heard a lot about already. It's the Caregiver Resource Centers and the restoration of funding there. 85 to 90% of all senior care in the nation is given by family caregivers. And if we don't have the infrastructure to train and support those individuals, those of us trying to do home and community-based services or people operating nursing homes are going to be completely overwhelmed, especially with our aging population. So we have to make sure the family caregivers are supported. Otherwise, we can't afford to age. The other thing that I want to highlight is the restoration of adult dental care. It's really a critical factor. Every 4 years, our agency, as all AAAs are required to do, we have to assess the needs of our senior community. And adult dental care or senior dental care has overwhelmingly been the #1 unmet need in our communities for the last several surveys. So we're going back about 7 years. It's almost twice as much as any other need that we see. That's happened ever since adult dental was taken away as a benefit. What's kind of crazy about the current system is we can pay for an extraction of an impacted tooth in emergency settings, but we cannot pay for a filling, even though the extraction costs far more than the filling, and even though we know that saving that tooth will keep the senior able to eat, it'll keep their nutrition up, and they won't end up being one of the high needs people that we have to serve in other expenses. So I really urge your support of those two programs along with the other things in front of you.
Thank you.
Good afternoon. Michael Richard with AARP California to speak in support of the $2.9 billion increase and restoration of funding for the Caregiver Resource Center. As has been mentioned, these programs have been cut by 74%. And just as the previous speaker mentioned, these are critical programs. Thank you.
Thank you.
Nicole Wortelman on behalf of the Ventura County Board of Supervisors in support of restoration of funding of the Adolescent Family Life Program. There are about 170 teenagers in the county right now that could use these critical services for starting out their families. Also, on behalf of the Alameda County Board of Supervisors, I'm here to support providing health care for everyone in California, regardless of immigration status. As the chair well knows, Alameda County does this and believes that it is critical to the health of the state.
Thank you very much.
Yes, Madam Chair, members, Darrell Kelch with the California Association of Area Agencies on Aging. We're here also to support the Caregiver Resource Centers. These centers are there for families when they are in their greatest needs, when they have no other idea of where to turn. And so we really urge you to consider restoring these funds.
Thank you.
Madam Chair and Senator Elizabeth Landsberg with the Western Center on Law and Poverty, and it's been very humbling to sit here and listen to all this testimony. We did want to lend our support to restoration of funding for the Black Infant Health Program, for the restoration of for continuation of the Medi-Cal primary care bump, and for the restoration of the Medi-Cal benefits. I also, of course, want to give a word of thanks for the dental restoration that went into effect May 1st. It's been wonderful to be able to tell our communities that they actually can get their teeth fixed instead of pulled. We do urge you to consider continued restoration because, frankly, some people have had teeth pulled and are going to need those partials. We also are here in strong support of the funding for the remaining uninsured. You're very well aware that the Affordable Care Act left an important part of our community out, and we need to serve them. Thank you.
Thank you very much.
Thank you. My name is Elaine Ellers, and I am the program manager of Sutter Teen Programs, and we are the local adolescent family life program providers here in Sacramento. And I've waited to be last because one of our very successful clients has been working and has been trying to get out of work. She was a client with us for several years. She graduated from high school, went on to college, has taken wonderful care of her child, and is now working for the state of California. But unfortunately, she was in a meeting and couldn't be here. And so I would just like to urge you on behalf of her and all of the rest of our clients to restore the general funding. Thank you.
Thank you very much. That's the conclusion of the public comments on the health-related proposals for restoration and augmentation, and the action will be to hold those items open for now. Thank you all for all of your testimony. We appreciate you being here today. Thank you for being such great advocates. We're going to move now to the rest of the agenda under Human Services. We're going to take a short pause before we begin again, so we will be right back on the mic with you in a couple of minutes. Thank you. All right, continuing on. Hello again, everybody. We are now looking at human services related proposals for restoration, augmentation, and expansion. We've invited panelists from the Legislative Analyst's Office and stakeholders who have suggested proposals for restoration and augmentation and reinvestment. So we will hear from them. The first, we will hear from the Legislative Analyst's Office, who will provide an overview in background to set the context. And following the Legislative Analyst, we will have proponents of the proposal speak for 2 minutes, and public testimony will follow that. And of course, we will have a panel on aging issues, and so we will hear first from the Legislative Analysts, and then we will call up the panelists, and that's how we will proceed. Oh, and we will also, of course, be hearing about CalFresh as well, and we will have panelists as well, and I'll name the panelists at that time. Thank you very much. Legislative Analyst.
Thank you, Madam Chair. Good afternoon, Senator Monning. Rashi Kesarwani with the Legislative Analyst's Office. As you described, I'll be providing a high-level overview of the 4 aging issues in your agenda, starting with the Adult Protective Services Program, which is overseen by the Department of Social Services. It provides services to elderly and dependent adults who are victims of abuse, neglect, or exploitation. Agencies at the county level investigate all reports of known or suspected abuse and neglect, in addition to conducting other activities. As a result of 2011 realignment, funding responsibility for adult protective services has shifted from the state's general fund to the local revenue fund. In 2012-13, total adult protective services expenditures were $122 million. Moving on to the next issue in your agenda, the Ombudsman Program is administered by the California Department of Aging. It includes 35 local programs throughout the state that are staffed by about 150 paid workers and more than 800 volunteers who investigate reports of suspected abuse of elderly and dependent adults in care facilities. Local staff and volunteers also conduct monitoring visits to care facilities. Beginning in 2008-9, general fund support of $3.9 million was removed from the program's budget. The final 2 issues on your agenda, the Brown Bag Program and the Senior Companion Program, are part of a handful of community-based services programs authorized by the Older Californians Act. However, general fund support for these programs was eliminated in response to the severe budget deficit in 2009. The Brown Bag Program, which provided donated food to low-income elderly individuals, was funded at $533,000 general fund in 2008-9 prior to being defunded. The Senior Companion Program paired elderly volunteers with homebound clients to assist with activities of daily living, such as chores and shopping. The program was funded at $261,000 general fund in 2008-9 prior to being defunded. Both of these programs were administered by the California Department of Aging, and the statutory authority for these 2 programs remains under the Older Californians Act. Thanks.
Senator Monning.
Thank you. I might have missed it, but on the California Long-Term Care Ombudsman Program, did you mention what the prior funding level was, or do you know?
We did not. It was about $8 million total funds with some additional local funds as well.
Thank you.
Sure.
All right. Thank you very much for that information. And we will now welcome our panelists on aging issues. Ginny. Oh, pardon me. We should have 2 panelists in this discussion. Carol Sewell, California Commission of Aging, and Daryl Couch, Executive Director, California Association of Agencies on Aging. Please proceed. Thank you. Push your red button there. Thank you.
Thank you, Senator Corbett. Good afternoon. I'm Carol Sewell, Policy Analyst for the California Commission on Aging and a member of the California Elder Justice Coalition. I'm pleased to be here along with our partner organization, the County Welfare Directors of California, who aren't right here. On behalf of the more than 30 organizations that have joined us in supporting Assemblymember Yamada's request to increase funding for APS training and to establish an APS staffing position within the Director's Office at DSS. Adult Protective Services plays a pivotal role in combating elder and dependent adult abuse. APS is typically the first to respond in cases that range from severe physical abuse to family members who steal using legal instruments like powers of attorney, to scammers who target vulnerable elders and dependent adults. It's caregivers who take advantage, neglect, or abandon those who depend on them, and well-meaning caregivers who just need support. It's self-neglecting adults with dementias or mental health problems. APS workers investigate and help clients and families negotiate the mazes of services that can help. They help clients stay independent, secure resources, and help make sure that perpetrators are brought to justice. The work requires highly specialized training. Workers must recognize subtle signs of abuse and understand the conditions that render adults vulnerable. They need to understand complex legal instruments and the legal system, along with the range of scams and schemes targeting the elderly and dependent adults. They must make judgment calls about whether clients are capable of making decisions on their own or are being unduly influenced. They work closely with the long-term care ombudsman, police, courts, attorneys, and many others. They need to be up to date on laws and regulations. But while APS is among the most challenging forms of social work, the state budget appropriation for APS training is minuscule considering the growing elderly population in the state. The current $154,000 budget is insufficient to cover the needs of all 58 counties for training new social work staff, providing advanced training for seasoned workers, and specialized training for APS supervisors, as well as for the development of new curricula to address emerging trends and legislative mandates. The appropriation amounts to less than $350 per worker per year based on the current 550 estimated APS workers in the state today. At this funding level, it is not possible to provide the full core training series to new APS workers, often leaving them underprepared as they go into the field to protect vulnerable elders and dependent adults. And training for these new workers is not coordinated to assure a standardized response. In addition, county APS is mandated under the Welfare and Institutions Code to provide mandated reporter training. Unfortunately, counties struggle to meet this mandate in light of increasing local workloads. County APS relies on timely reports from mandated reporters to protect victims from further harm. So training of these reporters is critical. State leadership and guidance are also needed to help county programs operate more efficiently and with greater consistency. State leadership is essential to respond to county APS program needs for information and resources. State leadership is also needed to establish information channels and help us better understand clients and their needs, evaluate program management and impact, and ensure that abusers caught in one county can't simply move or switch settings.
And we're at 3 minutes.
Our modest investment request would ensure that all APS workers have training that reflects current knowledge and has the oversight and accountability provided by state leadership. We urge you to take these critical steps toward creating the modern and professional APS program that California adults deserve.
Thank you very much. A very important program.